Let me tell you something that surprises many people. Not every heart attack happens in someone who looks sick. Not every heart attack happens in someone who is obese or diabetic. Not every heart attack happens in someone with obvious warning signs. Sometimes a person looks healthy. They walk every day. They walk normally. They go to work. They may even exercise, but suddenly they have a heart attack. And when that happens, people always say, how did this happen? He looked healthy. She looked fine. They were too young for that. They didn't look like someone at risk. But medicine teaches us something very, very important. A healthy appearance doesn't always mean a healthy heart. And to understand why, we need to begin where heart disease truly starts. Long before symptoms appear. Well, heart disease usually doesn't start suddenly. It starts very quietly, very quietly. Years and years before symptoms appear. Inside the arterial wall, tiny injuries begin. And this tiny injury introduces inflammation. And this inflammation will attract cholesterol particles which begin deposits inside the arterial wall. And all of this can happen while a person feels completely normal. That's exactly why someone can look fine on the outside while silent disease is happening and developing from the inside. And when that process begins, a plaque starts forming, often without the person knowing that. This plaque is a mix of cholesterol, inflammatory cells, calcium, and scar tissue building inside the artery. Most people imagine a big blockages, but early plaque may not block much at all. A person can have 20% plaque, 30% plaque, 40% plaque, but still feeling absolutely normal. No symptoms whatsoever, no chest pain, no shortness of breath, no warning signs at all, no lightheadedness, no dizziness. And this is where many people misunderstand heart attacks, because even plaques that do not look severe can still become dangerous. How come it becomes dangerous? This is very important because many heart attacks do not happen because of the biggest blockages. It happens because of unstable plaque. So unstable plaque is a small plaque but fragile plaque. It cracks suddenly. Then blood forms a clot. And this causes the artery to close. And this is a heart attack. So a person may have what looked like a moderate plaque, but biologically, the plaque was unstable enough to trigger a major event. That's why even someone who feels healthy can suddenly become a heart attack patient overnight. Let me give you an example. Let's say a 45-year-old man. He works every day. He is not diabetic. He is not obese. He exercises daily. He plays tennis once or twice a week. He feels healthy from the outside, but he has a very high LDL cholesterol, which is a bad cholesterol. Never checked himself up every year. He sleeps poorly. He has chronic stress from work. His father had a heart attack at the age of 52. And one day, like this, a small unstable plaque ruptures. And that morning changes everything. And what makes this even more important, that some people carry hidden inherited risks that are stronger than appearance itself. Now we need to talk about genetics. Some people inherit dangerous cholesterol patterns. They look thin from the outside, but from the inside, their LDL, which is a bad cholesterol, is very high. Some have high lipoprotein A. Some people have familial hypercholesterolemia or inherited inflammatory risk. They may look healthier than others, but they carry more silent risk. That's why body appearance alone never tells the full story. Because even thin people may still carry dangerous internal metabolic changes. Well, now let's talk about weight. You can find someone has a normal weight, but that doesn't mean that he is healthy. He still may be unhealthy internally. That's called TOFI or TOFI, thin outside, fat inside. He may have a visceral fat, which is a dangerous kind of fat, insulin resistance, fatty liver, hidden inflammation. All of this affects arteries every single day because internal fat behaves differently. It's an active tissue that produces inflammatory markers every single day. And inflammation is one of the strongest driver for plaque instability. So when you have inflammation damages arteries slowly. Inflammation makes plaque unstable. A person may not feel inflammation, but the artery feels it every single day. And this inflammation can be triggered by poor sleep, stress, exercise, smoking, processed food, chronic obesity, and sedentary life. One of the strongest daily contributors many people underestimate is sleep. A lot of people, especially in the Western countries, they sleep only 3 to 4 hours at night. But sleep and stress is very, very important. For example, stress is not harmless, but it can raise your blood pressure, heart rate, cholesterol, and inflammation. A person under chronic emotional stress and pressure can push unstable plaque towards rupture. Even if someone exercises, stress and biology can still continue working underneath. What about exercise? Exercise is good but cannot be a prevention. Exercise does not erase genetics. A person may walk daily but still carry dangerous cholesterol. So exercise helps, but it's not complete protection. Which is why some active people still get surprised when symptoms appear. And often before the major event, small warnings were already there. These warnings, people miss it very easily. And for example, mild chest tenderness or jaw tightness or shortness of breath or unusual fatigue. But they tend to explain it away by saying maybe I have a lot of stress or I have gas or bad sleep or a muscle pull. And unfortunately, this happens even more often when symptoms are not classic, especially in women. So women, heart attack or heart disease in women present differently, not as a classic chest pain. They may have nausea, they may have fatigue, upper back discomfort, or shortness of breath. And many cases get missed early. Which is why delayed recognition can happen even when danger is real. This is the problem. So what about young people? Are they immune against heart disease? Well, not. They are not immune. Especially if they have a strong family history, they smoke, they consume cocaine, they have severe inflammation or undiagnosed cholesterol disorders. That's why age alone doesn't fully protect anyone. This is where screening becomes very, very powerful. The first kind of screening is calcium score. Calcium score can reveal silent disease. Sometimes healthy-looking people already have calcified plaque. That changes everything because once you see silent plaque, prevention becomes much more targeted. So what are the blood tests that you can do that most people miss and can recognize heart disease early? Some of them like LDL, ApoB, lipoprotein A, high sensitivity CRP, and A1C. Normal basic labs may miss risk. And that's why many people remain falsely reassured until symptoms finally appear. So now I want to say why heart attack is the first symptom. For many people, the first symptom of heart disease is a heart attack itself. That's why prevention matters before symptoms appear. And prevention includes something people often ignore completely, which is sleep. As I told you, you need to sleep 7 to 9 hours at night minimum. Poor sleep increases your blood pressure, inflammation, and insulin resistance. Sleep apnea especially raises risk, and poor sleep quietly accelerates everything we have discussed before. Heart disease doesn't care how you look. You may look healthy from the outside, you may look thin, but heart disease doesn't care. It responds to biology, chemistry, genetics, and inflammation. That means true protection must go deeper than appearance. So what actually protects you from heart attack? Protection means know your numbers, control your bad cholesterol, LDL, control blood pressure, sleep well, exercise, eat intentionally and intelligently, and know your family history. Even small progress matters biologically. If you are overweight, try to lose 10 pounds. This loss of 10 pounds can lower your inflammation, your blood pressure, your blood sugar, and decrease your artery stress. Small changes can create major internal benefit. And this brings us to the final truth. Yes, heart disease can happen to healthy people, can happen to young people. Healthy people can still get heart attacks because appearance is not the full story. A quiet artery can still carry dangerous plaque. A strong-looking body can still hide inflammation. And a person who feels fine today may still need prevention. Your heart doesn't need fear. It needs awareness. It needs numbers. It needs prevention. If this video helped you understand your heart better, please subscribe. Thank you for trusting Dr. Nona's Power Lab. See you soon. Have a great day. Bye-bye.